Hello and welcome to the Physio Information Podcast. I am your host, Kirego. Today I'm going to talk about pelvic health during menopause, the changes, physiotherapy solutions, and tips for Kenyan women. Menopause marks a significant transition in a woman's life, bringing it with a host of physical and emotional changes. While symptoms like hot flashes, mood swings, and insomnia are commonly discussed, one area that often receives less attention is pelvic health. Yet, for many women, changes in the pelvic floor during menopause can profoundly impact the quality of life. So, what is the pelvic floor? This is a complex network of muscles, ligaments, and connective tissue that supports the bladder, the uterus, and the bowel, and it's highly sensitive to hormonal fluctuations. So, what happens during menopause is that there is reduced estrogen levels, which results in the weakening of the tissues, leading to challenges such as incontinence, prolapse, and discomfort during physical activity or intimacy. Fortunately, these changes can be managed with early intervention, targeted lifestyle changes, and physiotherapy. Kenya right now has a growing number of certified pelvic health specialists who specialize in guiding women through these challenges, offering tailored solutions for every stage in menopause. Let's go into detail and understand the pelvic changes during menopause. One of the changes that commonly occurs is the weakening of the pelvic floor muscles. During menopause, the declining estrogen levels results in reduced collagen production, causing the pelvic floor muscles to lose their strength and elasticity. This weakness can manifest as urinary continence, which is leakage during activities like sneezing, laughing, or exercising, also known as stress incontinence. Pelvic organ prolapse is another result of weakening pelvic floor muscles. This is a condition where organs like bladder or the uterus shift downwards, causing discomfort, a sensation of heaviness, or visible protrusions, which can be seen on the vagina. Another change that you expect during menopause is vaginal atrophy. This is due to thinning and drying of vaginal tissues. It can lead to pain during intercourse, also known as dyspareunia, increased risk of vaginal infections or irritation, discomfort during activities like suckling or prolonged sitting. Another change that occurs is reduced bladder control. Menopause often disrupts bladder ability to hold urine effectively. Women may experience frequent urination or urgency, difficulty in fully emptying the bladder, or an overactive bladder syndrome, where the urge to urinate becomes uncontrollable. Postural and core stability challenges. Uh, these are age-related changes to posture and core strength, which can exacerbate pelvic floor dysfunction. Weak abdominal and back muscles place extra strain on the pelvic floor, increasing the likelihood of a prolapse or other complications. So, what can you do to help with this? So, some of the lifestyle tips for Kenyan women. One is dietary adjustments, where I would advise you to incorporate fiber-rich foods such as arrowroots, bananas, and skuma wiki to prevent constipation, which can strain the pelvic floor. Stay hydrated to maintain bladder health, avoiding irritants like excessive caffeine or spicy foods. Then include calcium-rich foods, e.g. milk, um, fish, green leafy vegetables, and vitamin D supplements to support the bone and muscle health. Another thing you can do is regular physical activity, which is engage in activities that promote overall strength and flexibility, such as walking, swimming, or yoga. Physical activity also boosts circulation and helps balance hormonal fluctuation. Another thing that I would recommend is weight management. Excess body weight places additional pressure on the pelvic floor. Maintaining a healthy weight reduces the risk of prolapse and urinary incontinence. The other lifestyle tip will be posture awareness. Be mindful of your posture while standing, sitting, or lifting heavy objects. Proper alignment can reduce unnecessary strain on the pelvic region. So, what is the state of pelvic health in Kenya? What are the physiotherapists doing? So, Kenya right now has a growing network of certified pelvic health physiotherapists who are trained to provide specialized care for menopause related pelvic challenges. Their approach is holistic, combining evidence based techniques with personalized solutions. When you visit a pelvic health physiotherapist, this is what you would expect. One, a comprehensive assessment where the Kenyan physiotherapists use detailed evaluations to assess the pelvic floor strength, posture, and movement patterns. Tools like pelvic floor ultrasound and manual assessment are commonly employed. Another thing to expect is personalized treatment plans. These plans may include progressive exercise programs to strengthen weak muscles. For example, they'll ask you to do some Kegels, squats, some bridges, um, and manual therapy techniques to reduce tension and improve mobility, and then lifestyle counseling to support overall health. Another thing to expect is the use of biofeedback and technology. Biofeedback devices will help women visualize their pelvic floor engagement during exercises, ensuring correct technique and improving results. So this is machine that gives real-time results and helps you visualize your pelvic floor as you do an exercise. So your therapist maybe will ask you to contract your muscle while the device is on, and then you can see how the machine is behaving and how your body is behaving. And then you can put that into memory and you can practice. Another thing therapists will take you through is bladder and bowel training. This is guidance on managing urinary urgency, proper voiding habits, and preventing constipation, which is an integral part of care. So, what is a Kegel and why is it so popular? Kegels, they are named after Dr. Alan Kegel, who first popularized them in the 1940s. They are exercises that are designed to strengthen the pelvic floor muscles. These muscles play a critical role in supporting pelvic organs, that is the bladder, the uterus, and the bowel. And it's the bowel, I mean the part of the intestines and the rectum. Those are the parts that make the bowel. We are maintaining continence and enhancing core stability. A Kegel exercise involves repeatedly contracting and relaxing the pelvic floor muscles, similar to the action of stopping the flow of urine midstream. This movement strengthens the muscles, improving the ability to support the pelvic organs and prevent conditions like incontinence and prolapse. Why are these recommended? One, they're simple. Kegels can be performed anywhere, anytime, while sitting, lying down, or standing. Two, they're accessible. They require no special equipment, making them easy starting for pelvic health management. Another thing is they're effective. Consistent Kegel exercises can improve muscle tone, reduce symptoms of incontinence, and support vaginal health. And then they are versatile. They benefit women across all life stages from postpartum recovery to menopause. However, Kegels are not a one size fits all solution. Some women perform them incorrectly, which can worsen the symptoms and fail to deliver the results. That is why a guided, a guided way of doing them by a pelvic health physiotherapist is invaluable. Exercises beyond Kegels. What can you do? While Kegels are staple for pelvic floor strengthening, They are most effective when they are combined with other exercises targeting the core, the glutes, and the hips. Some alternatives include the bridge pose, where you'll be asked to lie on your back with your knees bent and feet flat on the floor. You lift your hips towards the ceiling, engaging your glutes and your pelvic floor. Another exercise is deep squats, which strengthen the lower body and pelvic muscles by performing flow controlled squats, ensuring proper alignment. Another exercise is the bird dog, where on your hands and knees, you'll extend one arm and the opposite leg, keeping your core engaged. This improves your pelvic floor stability and core strength. Another exercise will be the pelvic tilt, where you'll be asked to lie on your back with your knees bent, tilt your pelvis upwards, flattening your back against the floor and hold. This helps to improve the pelvic alignment. Another exercise could be the clamshells, where you can lie on your side with your knees bent, open your top knee while keeping your feet together. This strengthens the hip stabilizers and reduces pelvic tension. Another exercise would be a wall sit, where you will hold a sitting position against a wall and engage your thighs, your glutes, and your pelvic floor. There are so many other exercises that your physiotherapist can direct you in doing. Therefore, it's important to visit a therapist so they can guide you uh, on the exercises depending on your fitness level. When combined with guidance, the comprehensive approach to managing pelvic health during menopause would be very effective. So, what are we saying? That pelvic health during menopause is vital for women's overall well being. While hormonal changes are unavoidable, their impact can be minimized through proactive measures, targeted exercises, and professional physiotherapy. In Kenya, certified pelvic health physiotherapists are empowering women to navigate menopause with confidence, offering personalized care and evidence based solutions. By combining lifestyle adjustments with professional guidance, women can maintain strong, healthy pelvic floors and embrace this new phase of life without any fear or discomfort. So don't wait and consult a pelvic health specialist near you and take control of your health today. Thank you for listening. See you next time.